Welcome to 99 Shades of Pain show and podcast. This is the show where I aim to give you the best possible advice that I think everyone should know and needs to live a great life that, goes without unnecessary surgeries, unnecessary injections, unnecessary pain medication, and to avoid also just nonsense therapy or nonsense providers. Because we ain't got time for nonsense, right, Eric?
Absolutely not.
Ain't nobody got time for that.
No nonsense. And today's episode, um, doctors exposed.
Oh,
Yeah, we're gonna talk about the truth about unnecessary surgery and what to watch out for, how to avoid it, and you know something so you don't have to go through that experience.
yeah, because there's nothing I hate more than someone being pushed into surgery when they don't need it. That is some BS. So let's talk about it. Let's talk about it. So first thing I want to say is, look, sometimes you do need surgery, right? I'm not naive in that. I'm not a naive medical provider at all. Sometimes you do need surgeries, right? Whether it's a complete muscle tear, perhaps a certain kind of ligament tear. Um, there are so many situations in which surgery might be necessary and actually, like, really urgently necessary. However, there are times when it is absolutely not. And I can't tell you how many times a patient has come in through my doors with arthritis, meniscus tears, um, ligament tears, muscle tears, um, even scoliosis. I had a patient who came to me because she had scoliosis and her doctor wanted to insert metal rods in her spine. And the doctor mentioned, like, hey, you can't fix this, your growth plates have closed, and there's nothing that you can do to improve your situation. And who did we prove him wrong on so many levels? We're able to really greatly improve the curve to where now this patient, she could actually stand upright and not be shifted over to the side or completely rotated over. And when she went to her doctor, the surgeon was literally like, how the F did you do this? This is impossible. How did you do this? Magic, baby. Magic. No, it's just called good care, actually. It's called good care and attention to detail. That's that's the magic. But as it pertains to other conditions, so many people have come to me and said, Danny, look, like, you are my last stop. This is it. You're my last stop before I have to consider surgery X, Y, and Z. Before I have to consider living on pain medication my whole life. Before I have to consider, you name it, right? Ultimate circumstance. And we take those circumstances off the table. We take surgery off the table. We take medications off the table. We take having the need to go for injections off the table, which only further just cover up the symptoms, give you more poison into your body, and so on. So it's really avoiding surgeries that are unnecessary. It's so important because it will affect your whole life. Right? Once you do the surgery, once you get cut open, to get something taken out, get something put in, like that's usually it. That's You can't undo that. And a lot of people go for the surgery and they think, oh, okay, my doctor said I need this is going to solve my problems, and they do the procedure, and then, well, damn, the pain is still there, the issue is still there. Again, this is obviously not every case, right? Again, like, for people who need the surgery, you will probably feel better after the surgery, right? Like, if you have knee arthritis and that knee arthritis is truly the cause of your pain, which you will know, like, it's very clear if it is, and it's not just from a doctor saying, hey, you have bone-on-bone arthritis. That means nothing. But if your pain is constant, nonstop, agonizing all the time, the knee is swollen, everything is bad, and let's say you get a knee replacement, cool, you just got a brand new joint. Like, you needed that surgery, and now you have the opportunity, once you strengthen everything and once you mobilize the knee, to live a cool life where you don't have knee pain anymore, right? So that's necessary. But there are so many times when someone says, "Oh, you have bone-on-bone arthritis," and the arthritis truly isn't really that bad. That's not really the cause of the pain. It's there, but it's not the cause of pain. And I've known people who've gone for those surgeries and then still had pain, and they're like, "How the heck is this possible? You told me that the pain will go away." but it didn't. Pain is still there because you didn't treat the actual cause of the problem.
So I think it would be helpful to talk about how this process and this journey usually starts for someone. So we can use your example of, knee arthritis. Um, Before even getting the diagnosis of knee arthritis, because a lot of people may not know that's what they have. It's going to start out as like, hey, my knee kind of hurts. Let me go to the doctor, you know. And Danny, so why don't you walk people through kind of like step by step how we go from, hey, my knee's been bothering me a little bit, kind of annoying, not really that bad, to let's get the surgery. What are all the steps in between that take place?
So typically, and each step kind of varies and changes a little bit depending on the kind of provider that you have. So if they're a responsible provider, irresponsible provider, negligent or not negligent, right? So it really varies, but initially, let's say you have the knee pain starts and you go to your doctor. The doctor says, okay, let's order you up an x-ray and let's see what's going on. So they say, okay. So you go on the x-ray and let's say it shows something. Let's say it shows arthritis. And they're like, oh man, look at this arthritis that you got here. You see that? That's what's going on here. But that actually may not be the thing that's going on. So let's say that's what you don't know. Let's say you assume that that's what's happening. Then they're like, okay, look, we're going to give you an injection and then probably send you off to therapy. Now, the doctors know that traditional therapy, it won't really do much. Either it'll be just enough to drop some kind of pain, or it'll do nothing. To which case, they expect you to come back and be like, hey, didn't work. Then one of a few things will happen. Either they'll pitch you a more expensive shot, an injection, and more hardcore medicine. And once you do that, that will fail because eventually the medicine won't really take. Your body will acclimate and your pain will become worse because the medication covers up the symptoms. So the thing that's, the pain is an alert system that goes off in your body that's telling you, hey, what you're doing is hurting us. We don't know why, but it's hurting us. Right? So once you get that warning system covered up and you don't hear that warning, you can assume that everything is fine. Meanwhile, making the thing that's actually causing the pain to begin with, worse. So when the medication eventually wears off from the shot or when your body acclimates to the drugs, you're in worse pain than ever before. And then the doctor's like, oh, well, you're really far gone. I think it's time for surgery.
And how long does that process usually take?
It could take anywhere from 4 to 8 months, maybe a little bit longer. Right? By the time you get approved for x-rays and tests, and then you go to therapy for I guess like about 8 to 12 weeks. And then, there's some time again where you have to experiment with the medication and your shots. So, I mean, we're looking at minimum probably 4 to 6 months. Yeah. So that's about that timeline.
So what would the alternative route look like? Take that same
Oh,
example.
sorry. Before you ask that question, let me just add one more thing. Right when the surgery option is given, usually that will scare the Holy Ghost out of someone, and they'll try to avoid and look at acupuncture, which won't really necessarily help them, or maybe it does. They'll look at other things like massage. They'll look at other things like chiropractor. They'll look at other things like X, Y, and Z. And then eventually they're going to go to the doctor again, and the doctors will say, hey, you ready for your surgery?
So that's, before we move on to the next question, that's a lot of times insurance will actually require you, right, to go through and kind of check those boxes before you get the surgery. So a lot of clinics know this, and they actually have, the doctor will have PT in their office. They're going to have someone who can, a pain management doctor who could do the shots in their office conveniently. So they know that you come into the one doctor, you go to the PT, you get the shot, right? And then you loop back to the doctor to get the surgery. So they need you to go through that little spin cycle, through that little washing machine before you get the surgery to make sure you check all the boxes for the insurance so that you can get it.
Yeah, that's exactly a very big part of why those kinds of places exist, where they have, like you said, just conveniently so, All the doctors you need, all under one roof. Oh my gosh, look at that doctor, pain medicine. Woof, the convenience. Yeah, yeah. Um, but again, it's just all part of the same. It's all a cog in the wheel. It's just that's the routine, which again it lines the pockets of the doctors, right? I don't know how it safeguards money for the insurance, but it does. I guess while they collect premiums, I don't know, but like, but that's not very conducive to the person going through that experience.
Yeah, no, it's also kind of nuts because we, at Project Physical Therapy, we interview a lot of physical therapists that do want to work with us, that want to join our team, and uh, we hear from so many people that have worked at either like a meal type clinic or at like a surgeon owned clinic where they're PT working, for a surgeon essentially, and they get so burned out. They see so many people in a day. They don't really treat the way they need to treat. And we just kind of hear these crazy stories from other, medical professionals that are in this that are just like that want to get out.
Yeah, it's wild. It's wild. I mean, it burns people out for sure. When people have to be kind of, again, going through that whole insurance model where you're just maximizing patients, you're seeing tons and tons of patients, and everyone knows they're providing subpar care, right? To one degree or another, you may think you're doing your best in the situation that you're being put in, but people know deep inside, seeing 30 patients a day is not right, in an 8-hour window. Seeing 20 patients a day in an 8-hour window is also not okay.
Yeah.
So, yeah, this is a massive, massive problem. And then, it's no wonder, like I said earlier, the doctors expect the traditional physical therapy route to fail. They know they know they're going to see this patient 3 months down the line when physical therapy is over. They know. And it's very disappointing because, again, like on one sense, okay, this is the system for a lot of people, and a lot of people don't know better, and this is why we're doing this show, and this is why we're doing these kinds of resources, and why I post what I post online. But people need to understand that this is, if you're getting this kind of rigmarole, merry-go-round treatment, it's not treatment. It's just a waste of your time, which is a very, very valuable resource. And it's a very big problem because it makes people get a lot of very unnecessary surgeries that they could have avoided, time that they could have gotten back, a life that they could have lived better, had more fun, do more cool things, do more fun things. And because of this whole merry-go-round system, a lot of that, people are suffering for a lot longer than they actually need to. And it's very sad. It's really sad. It's very disappointing. On one hand, I'm really happy to be doing the work that we're doing here, which is like we're really trying to, it's not just about pain relief, right? The goal here at Project Physical Therapy is not just pain relief. The goal is to unlock your life. I like to tell my patients, when a patient comes to me and we do the consultation and everything, we're talking, I'm like, look, I just want you to be very well aware and understand what I'm looking after for you, right? I'm looking at 3 pillars. The 3 pillars are making sure, like the 3 pillars of your life that I want to impact are your personal life, your leisure life, and your professional life. Leisure, recreational, right? The personal, leisure, recreational, and professional. I want to make an impact in these 3 major pillars of your life because you need to be able to function and perform for work, right? That's how we need to live. You need to be able to function and perform how you want to perform through the recreational activities that you do. So whether it's hiking, going for a walk, biking, running, gymming, Pilates, martial arts, basketball, it doesn't matter what it is. But you need to be, if that's what you like to do and that's what you want to do, you need to be able to do that. And your personal life, if you are having trouble just doing basic things, grocery shopping, cleaning, dishes, laundry, playing with your kids or family, spending time with your loved ones, if that is a bother to you, I mean, we'll talk about quality of life, right? So pain relief to me is easy. But what I really want to enhance and improve are those 3 pillars to make your life mean something, to make your life actually worth living, to make you want to get up in the morning and can't wait to do all the things because, damn, your body feels good. But this is not the priority of most places, which is very frustrating and upset for the person who's going through this journey, because a lot of people just also, they don't know people like myself exist. People like me exist everywhere. You just got to find them. That's the trouble. That's the problem. You got to find them. But we exist. We care. We're out there.
So this loops back around to the second question. If we were to retake your example, right? Someone has a little bit of knee pain, and if they were going to go through an alternate journey that would not result in the surgery, in going through that whole process, what would that look like?
I mean, look, for example, when people come to me with a fresh injury, right, I primarily, I guess if I had to put a percentage on it, I'd say like 90%, 90 to 95% of my cases are chronic pain cases. People who've been in pain for 2 to 6 plus months, right? And then going into years and decades, right? This is primarily the people who I see. However, when people come to me fresh off an injury, we then go off of the natural body timeline, meaning every injury has a certain timeline of like where it'll just heal, right? Now, again, the problem becomes when you go through a natural timeline, but if you don't do the right things within this timeline, this is how that timeline gets extended, right? So if someone comes to me with a fresh injury, X just happened. Okay, cool. So now, by the time the natural healing will happen, by the time that natural healing process is done, you're done. That's it. So if your knee hurts and it's not because of a structural issue, right? And let's say it's a minor ligament sprain or some kind of muscle strain or some kind of overuse injury, instead of being stuck with pain and issues for months or years, you'll be done in weeks, right? Addressing the issue, addressing the injury. If it's an overuse injury, finding out why it happened to begin with, giving more support to the other supporting muscles that help the actual overused muscle relax, chill out, have more support, mobilize the joints, like anything that needs to happen, it's along this natural healing timeline instead of it being extended. So again, instead of someone dealing with pain since they were 22 and they're now 33, if the pain started at 22, you're good by 22 and 5 weeks.
So it kind of makes me wonder though. So like most people, I'm going to overgeneralize here a little bit, but a lot of people do not go to physical therapy right away. They, something will happen. They'll, maybe take an Advil. They'll sit on the pain for a little while, see if it gets better by itself, or they'll go to their doctor, if it gets bad enough where they get concerned, and the doctor, again, depending on the type of doctor you have, might send you home and be like, just rest. It'll go away by itself, prescribe you some stronger pain meds. Or they might send you to PT, but it might not be the right type of PT.
So first of all, when pain starts, right, not everyone should go to PT or even your doctor, right? So there's like a magic rule, right? So the way to know when you need to seek medical attention, right? This is the thing. This is the secret sauce. How to know if you need to just go see a medical provider. So pain X starts. Okay, from day one, the clock begins. So from day one to, let's say, day 7, you have to see a trajectory. So if the pain starts, does it peak? Which it typically does, depending on the injury, right? Again, this is very injury specific, but generally speaking, across the board, pain starts. Typically, it will start to peak, and then typically pain will start to drop, and then eventually go away. So if pain starts, kind of like if you ever woke up with like a weird feeling in your neck, like you can't turn it, right? Typically 3 to 6 days it goes away and you're good, right? Like by the end of the week or by the start of next week, typically Like you can turn your head again, the body restarted. So that's actually how an injury should go, typically, right? You should have this peak, things calm down, and the issue goes away. If the issue goes away, you're good. Like you don't really need to see me. If there's something lingering, that's different, right? The other thing is if you have an increase if you have a pain X starts, you have a peak, small dip, but then a prolonging of the pain for longer than 2 or so weeks, see someone. That's when you take action. But like you said, like seeing the right person will determine how long you have that pain for.
So who should you go see? So I mean, this is, part of why we're doing this. We're doing this show. We're trying to educate people, to give people more options. So it's like, do I go see my doctor? Do I go see my chiropractor? Do I go see my acupuncturist? Do I just need to go get a massage because it feels like my shoulder's a little bit tight and the massage is going to loosen it? Like, what do I do?
Right. So it depends on the injury. So let's say you tripped or you kind of, fell off the sidewalk, right? If it's a trauma-based injury, I would go to a physical therapist, right? With the minor exception where if you feel like something is broken or you're concerned for a break or for a tear, then you go directly to your doctor. But as soon as they take that X-ray or that MRI or whatever it is, and let's say there are no tears or there's like a small muscle strain, which is essentially like a grade 1 tear, and let's assume there's no breaks, you almost don't even listen to what they got to say. You go straight to the PT. Because this is the common misconception. When people go to the doctors for like pain in their shoulder, they go there with the assumption that the doctor actually knows the body from a musculoskeletal or neuromuscular standpoint. Doctors are geniuses as it pertains to the internal functions, but they are not the anatomical professionals for musculoskeletal or neuromuscular pains. That's us. That's me. PTs. Again, this is unbiased. This is just what it is. Physical therapists are the anatomical professionals. It is our job to know how does the shoulder actually function? What are the specific muscles that cross the shoulder or can impact the shoulder? What's going on with the shoulder blade? What's going on with the neck? Where can there be pain referrals from? I can't tell you how many times I get a referral from a doctor and I'm like, what is this? Has nothing to do with this patient. This referral has nothing to do with this patient. This is not their diagnosis at all. Perfect example. A patient came to me with heel pain. The doctor said, "Oh, it's a bone spur." Oh, you have pain because you have a heel spur in your foot. Oh, you bruised your foot. No, it was pain coming from her back, and I know this because we worked on her back and pain went away, and that pain has been present for like 2 years. So this is what I mean. Doctors' internal function, like cancer, diabetes, like all of those things. Doctor. But for musculoskeletal and neuromuscular issues, nah. You go to see a physical therapist. Again, rule out what you got to rule out because, again, as it stands right now, PTs, unfortunately, I don't know why, are not allowed to order X-rays, do X-rays, order MRIs. I don't know why. It's crazy to me, but
it's just. I mean, that goes, a little bit political, but it's just in almost every state, the rules are completely different.
yes.
But not too long ago, in almost every state, you had to go see a doctor before you could see a physical therapist, which is kind of funny based on what you just said, because a doctor, they'll know what medication to prescribe you to relieve the pain, but they have no idea how to actually fix, the problem in your knee and your shoulder and your back. But you had to go to them for permission to go to see the physical therapist.
Well, you know what it is? I think what it is that because most places are insurance run, the patient has to justify why they need their services covered, right? So if you go to a doctor and they did an X-ray and the doctor says, "Hey, you have arthritis," or the doctor throws a diagnosis code on the condition, then it's a justification for the insurance to be like, "Okay, well, I guess you need therapy." Fine. will
But it's
cover
so
your
crazy
therapy.
because a lot of the times the diagnosis is just wrong.
I know.
So
That's what I just said. Yeah, I know.
so I mean, even for insurance purposes, this seems completely backwards because okay, you go to the doctor for the diagnosis, but if they provide the diagnosis, this insurance company is now paying for treatment for the wrong diagnosis, right? So you're
Homie, the whole
treating.
system is backwards. The whole system is ass backwards. All right. Everyone's dropping the ball here, right? Because again, the system as it stands does not work for the patient or for the provider, but definitely not the patient. Again, that's why people like me exist, because I have to operate outside of the system because the system is ridiculous. The system will put red tape all over the place where red tape does not need to be. The system will pay for ridiculous things that don't actually help, but it's just something that they pay for. Like why do insurance companies promote the idea that PT should put hot packs and cold packs on someone? Like, how is that not a giant waste of time? It's a time filler. Same as eStim, right? Like eStim, there's no researched evidence of benefit for most cases, right? Unless we're talking about very specific applications for eStim, which is electric stimulation. That's the electric patches for anybody listening. There's only very, very specific. And okay, let me put it to you this way: in the last 4.5 years, I used it once, and I used it on the one person that I used it on. It was because they had a botched spinal surgery, and she had almost complete nerve loss of the muscles in her leg. And so her muscles.
That was because of the surgery.
Yeah, because she had anterior listhesis, which is a slippage of the spine, like the bony segment on top of the other, and she had to get a surgery for that. But the surgeon nicked her nerve, which caused massive damage. And she was the only one who I used eStim for. And while doing eStim and TENS units, we were doing active therapy around it. But that was the only time I used it for. But how people usually use it is they'll get put on these patches and they'll get left alone for 10, 15 minutes because it's a time filler, not because they clinically need it, but it's just to fill time. Because while they're on there for 10, 15 minutes, that's a couple units right there while the therapist runs to someone else. Or they're just doing charting in the back. I can't tell you how many times a patient said, like, yeah, my PT just put me on a bike, and then they look over at the PT and they're just behind the computer doing notes. So why would a patient feel inclined to stay there? Why would a patient feel inclined to go back? Which is a lot of my patients have just left PT after a couple weeks because they're like, I can do all this stuff at home. Why am I wasting my time here? They make me wait for 30 minutes to an hour before my appointment time is off. Even though I have an appointment for 2, the appointment only starts at 3. And then they just put me in the same loop week in and week out. Why am I going to this? It's crazy.
Yep. No, it's absolutely insane. And the really horrifying part about all that is, what would happen to that patient if she never went through with the surgery in the first place?
What would happen to the patient if they got really good quality care in the first place?
Well, that's kind of what I'm talking about. So,
better outcomes.
The surgery that was messed up caused the symptoms, which is why you should be very careful about getting surgery and make sure you explore all your other options before you do it. Sometimes it's necessary.
Yeah, but she needed it. She needed the surgery.
Okay, so she needed it.
She needed the surgery, yeah, because it's also hers was to the point where the bone fractured, so she needed the surgery. But again, like that's just one of those things where it just was an unfortunate. She was a statistic, right? Unfortunately, this is just part of the procedure where it was a botched essentially. Like the nervous system, spinal surgery, so can be very scary sometimes, just because everything is so close to each other. And you nick a nerve centrally, that'll affect everything down the line, everything. And so you got to be really careful if you're doing kind of any surgery procedure, even for the shoulder. Like you got to be super careful with what you're doing, and if you truly need it. I'll give you another example. I had a patient. She came to me with a supraspinatus muscle tear. It's a muscle that's part of your rotator cuff, sits right on top of your shoulder blade and attaches right in through about here. And um, she, in addition to the supraspinatus tear, she also had a labrum tear, two of them actually. And when she came to me, she couldn't do anything with the arm. She couldn't reach in front of her to grab a water bottle to lift it up. The arm would just give out, pain, really bad. And so the doctor's like, okay, look, it's like a 50% tear, which is like right on the verge of like, procedure or no procedure. The doctor was like, listen, I recommend surgery. You can try the non-surgical route, but I recommend surgery. Now, she went the non-surgical route. And so we started to get to work right away. So we went from not being able to do the water bottle to doing the water bottle and weights, and we started to get stronger, better. About two and a half, 3 months down the line, she got another MRI. And it showed, this is the crazy thing, and I think that the MRI, whoever read their MRI was wrong. It showed that the tear got worse and that she had a secondary tear elsewhere in the shoulder, in another part of the rotator cuff muscles. And which was hilarious because on paper, it said it got worse and that she has more damage. Yet, she was swimming. She was using the shoulder. She was throwing, playing ball, throwing the ball with her dog, playing catch. And she was able to pretty much just about do anything. But it was worse. So the doctor kind of scared her into doing the surgery. And they were supposed to do some very elaborate, like if they were going to do the surgery, this particular procedure, there's about a 6-month rehab, timeline, which is pretty damn extensive. It's like 6 to 8 months. And when the surgeon went in to do he convinced her to do it. And I was like, listen, you're doing really well. I can't tell you what to do or what not to do. All I can tell you is where we're at right now. The surgeon convinced her to do it. When they went into the shoulder, they opened it up, went into the shoulder, and they're like, what the hell? It didn't match the MRI. They ended up bypassing that 6 to 8 month recovery timeline procedure. They ended up bypassing that entirely, and they just did a labrum cleanup, which is like an arthroscopy of the shoulder. They just shave a few places just to make it smoother. But goddamn, she didn't need the surgery. And then that actually took us back 10 steps. But she didn't need it. Yeah. She didn't need this. And it took us back 10 steps to the point where now, again, because she's also in a sling for 3-4 weeks, and that stiffens up the shoulder like that, that also created pain through a lot more places. She developed nerve pain from her neck because of the immobility from the shoulder. We did such a good job of training up rotation, which is what she wanted to do for swimming. That erased. And we kind of we didn't start from square one, but we started from if we went through 100 squares, we probably went back to square 56.
We get so many calls from people who, it's funny when we talk to them on the phone. It's like, hey, I'm scheduled to go for surgery in 4 weeks, but I'm wondering maybe you guys might see something different. And some people we talk to and we're like, okay, come on in for a consultation. Let's see. Maybe you need the surgery, maybe you don't, but let's figure out what's going on. But other people, their doctor has scared them so much that they call us and they're like, you know what? I'm just going to wait till after the surgery and then come in. And it's like, what? Why? But the fear is crazy.
Listen, we are emotional creatures. We are emotional beings. And if someone speaks to one emotion more than another, that will be the deciding factor. There's nothing that will make us make a decision faster than fear. right? If the fear of what will happen if I don't do the surgery trumps the fear of the surgery, well, guess what? You're doing the surgery, right? Whether it's necessary or not doesn't matter. It's the perception of the information given to you by the person that's providing said information, whether it be true or false, or partly true or partly false, right? So whatever fear, whatever emotion trumps the other one, that's the action that people take. And sometimes, like you said, it's very true. It's, I'll have a consultation with someone and I'm like, in the back of my mind, I know we didn't do an evaluation yet, but I know you don't need surgery. Oh my gosh, like none of these symptoms make sense. You don't need it. And then they end up calling us later to reschedule or cancel the evaluation. And like, yeah, I think I'm gonna do it. I'm gonna do the procedure and I'll see you guys after for the rehab. I'm like, you're turning what could have been like 5 weeks into 6 months. No.
Yeah, you can always get the surgery later. Like the surgery is always an option after, but you cannot go the other way.
There's no going back.
There's no going back.
Nope.
So like, explore all your options before you do the surgery. And again, it may be necessary, right? Like you may have to do the surgery. But you should only do it when it's actually necessary.
And look, also, if you're going to do the surgery, do us a favor. Please research your surgeon. Please. Like, look up reviews, look up experiences, go on Reddit, go on Facebook. Just see what you can find out about the person who's doing your surgery. Because the last thing you want is to go into surgery with someone who is either inexperienced or one of those people who are just in it for the money, right? Going for a consultation, right? Speak to the person, ask them questions, see how they respond to your questions, see if they actually truly care about you before you go. It's just like any provider, right? If you go to a PT, like you want to make sure that they truly care about you and they want the best for you, and they're gonna do everything that they can to make sure that you have the best possible outcome. Your surgeon is no different. If I was to had to go get surgery tomorrow, right, or in a week from now, whatever, right, and I'm first thing I'm doing is I'm sitting down with the surgeon. I'm not just booking blindly and pop me up on the table, doc. Like I want to talk to you, and not only talk to you. A lot of them will say like, "Hey, come in for a consultation." I'm going to ask you questions, and based on how you answer those questions for me, that will make my decision of whether or not you're going to be my surgeon. If you're going inside my body, if you're doing anything to me, even if you're not probing me like an alien, it doesn't matter what you're doing, all right? But if you are my provider, I want to ask you questions and I want those questions answered. If I am your provider, I want my patients to be asking me also. I will ask my patients before they leave my room. I'll ask them 3 or 4 times. Are you sure you don't have any questions? Come on, just ask me something. Give me something. I want to answer something for you. And I'm like, no, Danny, you've been really thorough. You're good. You're good. I'm like, are you sure? Are you sure? Because I want all of my patients to have all the questions. There's no little question gremlins in the back of their mind wondering, what about? No, none of that. I want everything to be super clear, super understandable. No questions in the back of your mind. I want everything to be amazing. And every provider needs to provide that same kind of experience for you as well. Like that's where we got to raise your expectations, raise your standards.
Danny, I got a question that you can answer.
Damn it. What?
Is there any way of managing nerve pain, the legs or sciatic nerves? I think this person meant in the legs or sciatic nerve.
The legs or okay. So anyway, managing nerve pain in the legs or the sciatic nerve. So we had a very similar question to this yesterday on the show, and the answer to this question really depends. Where is that nerve pain coming from? Is it truly your sciatic nerve? Is it truly sciatica, meaning coming from the center of your spine, from a disc herniation, stenosis, whatever it could be? There could be a lot of different reasons. but where is your pain truly coming from? Only then can we answer this question and have a good understanding of, okay, what actually needs to be done? How do we not just manage? Because manage kind of to me sounds like you're just maintaining something, right? We're not trying to manage pain. We're trying to eliminate and eradicate pain. And the only way to eliminate and eradicate pain is by making sure we truly have that understanding of, okay, this pain clearly coming from here. Okay, here's what we got to do. If the pain is coming from here, then we got to do X, Y, and Z. We have to create a plan of what's going to be done at home. We have to know this whole thing of like what's the plan of attack. And it's not a buckshot, at the target. It needs to be very specific and programmed and progressive. And if it's not, this pain will not go away. So again, find the root cause of this pain, and you'll fix it.
All right, cool.
What else you got?
If anyone's got any questions, please drop them in the comments, and we'll do our best to get to them. The next one I've got is, what's a good exercise to strengthen the ankle that tends to roll?
So unstable ankles is something that's pretty common, something I see quite a lot in the office. Typically, if your ankle rolls, that means that the muscles around the ankle that provide the stability, right? We have some pretty big muscles like our calves, the muscle that looks like a butt. So those are like what's called your primary motors. You have other muscles that kind of go along the sides. There's a grouping of muscles called your stirrup muscles, like when you're in the saddle of a horse and you have your legs are in that, stirrup. So the reason they're called stirrup muscles is because they literally go through the sides of your lower leg, and they attach into different parts of the foot and ankle that provided support. So a lot of times people who tend to roll their ankles a lot, these muscles are just not strong enough, number one. Number two, the proprioceptive control, right? So the proprioceptive control from your brain to the foot and ankle is not quite there.
What does that mean, the proprioceptive control?
So proprioception is a type of balance, which is kind of we spoke about this the other day, but proprioception is a type of balance where you have an awareness of your joints and your limbs in space, meaning you cannot look at your hands, but know what they're doing. You don't, like when you're walking, you're not thinking about moving your legs, but you know exactly how they're moving. Right. So when you stand,
it's kind of like when someone's walking down the street and they're buried in their phone, but they're walking and they still know that they're walking.
They still know they're walking and they're not just falling over, right? Because they have enough proprioceptive balance to look at their phone and are you watching me walk down the street? They have enough proprioceptive balance to not fall over as they're walking.
But sometimes not enough to not walk into a stop sign.
Yes, I've never done that. But yes, that's a problem. That's a lack of awareness of your surroundings. You're not using your visual balance for that. But yeah, so people who tend to have problems with like rolling their ankles, you just need to do more balance work. Single leg balance work. You need to do strengthening and stability work for those stirrup muscles, and that'll, you can never prevent an injury completely. It's impossible, and anyone that says they can prevent an injury from ever happening, they're talking out of their booty. But you can greatly minimize that and take it almost off the table if you do that strengthening work, the stability work, and that proprioceptive work.
Cool. So that was the last question for now.
Cool.
Was there anything else you wanted to cover on this topic?
No. I think we kind of really beat the dead horse here. I think people will understand, but just like a final message here. Make sure that if you are going for surgery, you need the surgery. The last thing you want to do is go through the process, the anxiety, the craziness of going through any kind of surgical procedure, and then finding out you didn't need it. That's the last thing that you ever want to go through, because not only are you still in pain, but now you have to deal with the recovery process of that procedure. And even if it's a minimally invasive surgery, right, make sure you can need it. Make sure. Again, like Eric said, that surgery, that procedure ain't going nowhere. It's there. It's always there. They will book you like that. But there's no going back. So if you need it, get it. Hands down, get it. But if you don't, or if you think you might not, or you want to explore an option before you do the procedure, explore those options. You'll be so happy and thankful that you did.
Yep.
So,
Absolutely. And if anybody wants to, consult with us, if you're from New York or Florida, we're licensed to work in both those states. There's a link down in the description below. Click the link, and we're happy to talk to you to see what options you have available and if we can possibly help.
yeah. So that's exactly right. I'd love to speak with you. Our other therapist, Uriah, would love to speak with you and see what we can do to help you live a better, healthier, non-surgical life. So with that being said, I hope you've enjoyed this episode of 99 Shades of Pain, and we will see you again tomorrow.
See ya.
Bye.